Secretary, can you give us an update on these health centers that were supposedly ghost, substandard, not completed, that came out in the news recently? Can you clarify whether or not these centers are in the process of being built para po talagang maging accessible ang primary healthcare?
Well, since 2022, 23, they have been funding super health centers in many parts of the Philippines. There were about 800 that were funded, and I analyzed all of them. There were only about 200 that became functional. About 500 have been completed. 300 are still undergoing construction, but there are also about 312 that have been completed since last year but have not been made to function. So
Because
these are the ones that we are now trying to...
Walang
Yes,
personnel.
because of lack of personnel. You see, these super health centers are run by the local government units. And they promised, they signed a memorandum of agreement when this funding was given to them. They signed an agreement that they will hire the necessary doctors and nurses that will run this. Unfortunately, some are unable to hire. So there is still a problem with this system, and I'm trying to find ways to correct this. We have a national health workforce support system wherein we deploy doctors and nurses that we pay the salary through the Department of Health. But we give this to the 5th class and 6th class municipalities who really have no funds to pay for hiring. But there are other LGUs that can afford a percentage of their funds for hiring health personnel.
Is that because of brain drain, Sec? Because that's alarming. If there are cities and municipalities that actually have the revenue to be able to afford these healthcare workers, but there's none to be found, then how can the DOH step in and help them, kumbaga, as a headhunter?
That's one of the reasons. So what we've done is we've told these local government units that receive the super health centers to get their current personnel in the old facilities and put them in the new, so that the new facility can function and provide better services for their people and their constituents. And then we will find a way to repurpose the old one. We can renovate it and improve it, make it a maternal and child care center, an animal bite center, or some other facility. That way, you expand the facilities in the local government unit. The other option is, when I announced this, there were many in the private sector, especially because now that there is a PhilHealth benefit package of Yakap and Gamot, some private sectors are interested to take over these facilities and run them for the LGU. So that's another option we're looking at. So it looks bright that we can have people that can run this, especially with telemedicine, with even with less personnel, we can run them through our DOH hospitals as well. We can rotate people through them. But the LGUs have to give them back to the Department of Health. So that's the problem. It's already owned by the local government unit. So they'll have to turn it over to us, and then we will run it.
Okay, and many have expressed interest in this.
Yes, yes.